Hi, everyone. My name is Orly, and I'm a PGY1 in internal medicine. I'm very excited to present our work today called Quality of Care and Outcomes in Internal Medicine Patients, Bed-Spaced to Non-Internal Medicine Units, authored by myself, Dr. Jessica Liu, Dr. Ben Kadeski, and Dr. Chaim Bell. As I'm sure most of you know, there's a very widespread practice called bed spacing, in which admitted patients from GIM are placed on a different specialty's inpatient ward. Yet, there is not much research done investigating the impact of this practice on healthcare quality. We wanted to investigate whether hospital outcome measures differed between bed-spaced GIM patients compared to non-bed-spaced patients. We used a retrospective design and included patients admitted to GIM wards at 2 academic hospitals, comparing bed-spaced to non-bed-spaced patients. Our primary outcome was percent ELOS, which is defined as the length of stay, LOS, divided by expected length of stay, ELOS. We also compared the groups with respect to 30-day readmission, adverse events, and in-hospital mortality. We included 22,519 patients. 71% were discharged from a medical ward, and 29% were discharged from a non-medical ward. Bed-spaced patients had significantly shorter lengths of stay, expected lengths of stay, and percent ELOS. They also had significantly lower in-hospital mortality rates and fewer adverse events. There was no difference in readmission rates. We found that bed spacing is very common, 29% of the sample size. As well, though we hypothesized that bed-spaced patients would have poorer quality of care, our results actually showed the opposite. It may be that non-bed-spaced patients had higher care needs. Although our comorbidity scores were similar, the non-bed-spaced patients were more frequently discharged to places other than home, i.e. a higher level of care. While there's subtle differences, there may be an inherent selection bias that is not protocolized or captured by our metrics, so that less complex patients, regardless of comorbidity score, are preferentially bed-spaced to non-GIM wards. If we had looked at and measured process of care metrics rather than outcomes like mortality, we may have been able to better elucidate these key differences within the effects observed. In fact, some of the differences seen in our study compared to previous studies may be a reflection of these differing applications of this practice. Overall, our recommendations would be for hospitals to standardize their approach to bed spacing and attempt to formally derive guidelines for patient selection. As hospital volumes continue to be an issue, bed spacing will likely remain a strategy to offload our busy emergency departments. It's reassuring that our results suggest that this common practice may not result in poorer quality of care. The ultimate goal is to optimize the quality of care of all patients, regardless of geographic location in the hospital, so that we can treat the right patient in the right location.